What's up? It's Chris from chrisbeatcancer, and we're on the Cancer Survivor Couch here at the Back to Health event in London. And I'm really excited to be here. And Jessica Richards is someone who I've met through Facebook maybe a year ago, something like that, or maybe
a lot longer than that.
More than a few years.
Yeah.
So anyway, we've chatted on Facebook here and there. She has an incredible survival healing story. And I was thrilled to see her at this event and pulled her aside and said, we got to do an interview. So here we are. Thank you.
Thank you very much, Chris. It's great to see you here. Welcome to London.
I feel very welcome. I love London, love English culture. It's been a real treat. And we're actually already talking about my wife and I making plans to come back next summer.
Fantastic.
We love it that much. So
we'll be waiting for you.
Yeah, it's been great. So let's talk about your story.
Okay, well, I was diagnosed over 9 years ago now, it was in May, with a very large breast cancer. According to the medics, it was 3.5 to 4 centimetres, invasive ductal carcinoma. I did have a lymph node biopsy, which was the only surgery that I had, which was a diagnostic. 2 sentinel nodes and 1 non-sentinel node. They found a single metastasis in a single cell in one, a micrometastasis in another sentinel node, and nothing at all in the third. My initial thoughts were, I'm going to give myself a bit of time to think, because you know when you've been diagnosed with cancer, you can't think straight, but you're immediately expected to make some really complex and critical decisions when you've just had the shock of your life and you're in fight or flight mode.
Yeah, they rush you in.
That's right.
I mean, there's urgency, they're rushing you in, there's no time to think.
Yeah.
It's just like you need to make these just very, like you said, critical decisions immediately.
And they're complex too.
And they're complex, and you have no idea. You don't even understand the process.
Absolutely, and at first you can't even think of what your name is, let alone what you're going to choose, which the treatment itself, as you know, can be life-threatening.
Yeah, absolutely.
So a disease which is not making me feel ill, and treatment that will make me feel ill and maybe kill me, is that you can't make that decision in just a few seconds.
That's an important point you brought up, because a lot of cancer patients actually feel fine.
Yeah, and they look fine.
When they get diagnosed.
Yeah.
They feel fine, they look fine, their quality of life is normal.
Yeah.
They're not sick.
Yeah, that's right.
But then as soon as they start treatments, then they get sick, right?
That's right.
And their quality of life goes in the toilet.
That's exactly it, and I find there's a lot of misunderstanding out there as well. I've done lots of interviews with journalists, and they say, can we have some before pictures? And I said, well, I look exactly the same before as I did now, just a little younger, you know. And they said, no, I haven't got pictures with your hair falling out. And I said, cancer doesn't make your hair fall out, the treatments do. But people seem to think if you get cancer, it's the cancer that makes you experience those symptoms, and actually it's the treatment, and I think that's an important point.
Very important point.
So
when you see a cancer patient, you're really seeing a chemo patient.
That's exactly it. When you see those symptoms, absolutely. So I thought at the time the best decision that I made right the way through it, I thought, I didn't get this in just overnight. I don't have to make these decisions. In fairness, on the NHS, they have particular criteria. You have to have surgery within 30 days of being diagnosed. End of.
Really?
Yeah.
Or what happens?
The hospital gets fined.
Oh, wow. I didn't know that.
Oh, yeah.
Interesting.
But it was set up for a good reason, so that people weren't left
So they weren't left
needing
behind
or wanting
if
surgery.
they wanted it. Yeah.
And they're not
understand
getting
that.
it for months and months and months. So they were on the ball with that. So the best decision I made was, I didn't get it straight away. It's probably not going to kill me within the next few weeks. If it does, well, it's a bit of a moot point anyway then, doesn't it? It's academic, what I would choose.
Yeah, but what made you think differently compared to thousands of other, just breast cancer patients, right? I mean, not to mention every other cancer.
Yeah.
What was the difference?
I think I grew up, I was always a bit left of centre. I wasn't brought up like other people. Well, we were homeless and potless most of the time. Loads and loads of different schools, and I suppose it's just my nature to always question the status quo, because some things are established as facts and they make no sense at all. They came from nowhere.
Yeah.
Other things made sense once but decades later, they're just not relevant.
That's a great point.
And so we just need to question them. So when I started to ask questions, I found that I interviewed several consultants. Nobody could give me what I consider to be reasonable explanations that would cause me to choose to bet my life on certain treatments with an iffy outcome. I was actually told, if you go through all of this, there's an 85% chance that you'll be cured. And I said, well, I thought there wasn't a cure for cancer, so how on earth have I got an 85% chance I'm going to be cured from it?
That's some critical thinking.
So I said,
and what did they say?
What is your criteria for a cure? And when I heard the criteria for a cure is if you are alive and well 5 years after your treatment. At the time I was 50 years old, and I said, well, I can probably in the end I had to make the decision. This is either going to kill me or it isn't going to kill me. Do I want to go through treatment and if I survive it, be a patient for the rest of my life? The answer to that was no, not in my case. If it is going to kill me, do I want to spend the last year and a half of my life in and out of hospitals? No, I didn't.
You know, you made me think of something, which is a lot of cancer patients have a tremendous amount of family pressure, right, to just do the treatment.
Yes.
Did you have that?
Yes,
you
big
did.
Time. I've got 6 siblings.
Yeah.
Both my parents were alive at the time. Apart from my father, they were on and on to the point I had to ban them from speaking to me about it. I said, you can speak to me about anything you want. You are not to speak to me about my choices. And I said to them, do you really believe that I've asked advice from people who know even less about it than you do? And of course, there's no answer for that.
Good.
My father...
This is really good. I hope you're paying attention.
Yes.
This is really critical.
Even you can end up with white hair like this at the end of it, but I'm still alive growing hair.
That's right. That's right.
But my father did say to me from the start, he said, I don't know anything about treatment, but he said, I know that whatever decisions you make will be the right ones because you know how to make decisions and you're a winner. And he never, ever questioned.
That's awesome. And that you just needed that one supporter, right?
Well, with or without it, I would have done it because he and my mother both died within a couple of years after I was diagnosed. Then I split up with my long-term partner and things all went a bit belly up. And of course, I had to pay for everything privately. And that meant that I almost went bankrupt.
Now, did a lot of your friends know that you were going through cancer as well? I mean, did you keep it quiet or did you just pretty much tell everybody?
No, I didn't. I told, on the first part of it, it was a need-to-know basis.
Right.
And I want everybody else to know, because I think most cancer patients want ordinary things. Well, you can't have ordinary experiences when everybody's looking at you thinking, you know, is she going to fall off her perch this week or...
Yeah, you're like the elephant in the room. Oh, we're doing an interview. Okay. We'll talk in a minute. That's true.
So I did a need to know.
Yeah.
I only told my parents and not all of my siblings. And then I set up satellite people. So I put one friend who would tell my friends, so I didn't have to keep repeating everything. One business associate who told all my business colleagues and friends, and one family member who would keep the family updated so that I didn't have to talk to everybody about everything all of the time.
That was a very organized, systematic
I'm quite an organized
method.
person.
That was really good. Yeah, that's really good. I mean, you're giving some very good, very good practical steps and good information.
I only do
so
practical.
excited.
That's why I wrote my book, which is just a manual. 10 chapters, 10 things in each chapter. So it made it very simple to get in and just ask what on earth you needed to ask about at that time, because people were inundated. Oh, have you read this? Have you been on that? And I was thinking, for goodness sake, I might be dead in a year. I haven't got time to read every bit of literature.
Right.
So,
and the name of your book is?
The Topic of Cancer.
Okay. The Topic of Cancer, Jessica Richards, in case you don't make it to the end of this interview.
Oh, right.
So,
yes, thank you for that.
Yeah, so...
Could I just say, though, Chris, at this point, The only reason that I've gone public with my story, because it's not an easy ride, as you know, when you go public.
Yeah.
It upsets as many people as it encourages them.
You've had some pretty major media coverage.
Oh, yeah.
I mean, that's how I found you initially, whenever that was, a few years ago, and I was like, be my friend, right?
Yeah, that's right.
You know?
I think I might.
Yeah, yeah.
But the only reason that I've gone public with my story is that I am firmly committed to the fact that we have a right to have access to information that enables us to make informed choices on our own personal pathway of care, whatever that is. I don't care what people choose. We have a right to implement our choices safely, and our medical and healthcare teams have the right to support us according to what they believe is in our best interest as members of our teams, without fear of breaking the law or of losing their good name or reputation. That's why I've gone public.
And what you're talking about really can be summarized as medical freedom.
Absolutely.
That's what we're talking about.
Yes,
is having medical freedom and giving doctors freedom to treat the patient as they wish.
Absolutely.
Without fear of repercussion, losing their license, being fined, being ostracized, whatever.
That's right.
Is ostracized a word, or did I just make that up?
It is now. It's all right. You're in England. You can just say it with a posh accent.
It's an English word. So, right. We are in complete agreement on this.
Yes.
Patients need, they need information, right? They need to just understand their choices before they're rushed in.
Yes.
And B, we hope at some point the tide will turn, and patients will have not only access to information, but freedom to make choices about the treatment they want, and get access to the treatments they want, and get medical coverage, because you just said you almost went bankrupt.
That's right.
Paying for your own treatments.
Because the NHS I've contributed to since I was 15 years old as a taxpayer, I couldn't access any treatment from that, although I was very grateful for it, because I was very grateful to have access to excellent consultants on the NHS. So there is that, but they're unable to give us the treatment that we might choose. Right,
and in the US is very different, obviously. I mean, you have national health care, we have private health care, and Obamacare is some national health care, but it's complicated.
Yeah.
But the point is, either way, in the US, patients have the same issues. Insurance won't cover nutritional therapy. It won't cover anything that's alternative, right?
That's right. Or integrated.
Or integrative, right. So it can be very, very expensive to get those type of therapies. So,
I will
good
tell you
transition
something
point.
interesting though.
Yeah.
Last month in June, I went to a seminar at the Royal College of Medicine here in London. And it was called Food, the Forgotten Medicine, completely presented by medics. They could have sold it out 4 times over. And it was so popular, they're going to hold one every year, and they're including food producers and manufacturers as well as, with the intention of making it part of the normal training of doctors and nurses and other medical practitioners.
That is brilliant. That's a huge step forward.
Yeah,
huge.
That
that's
food could be part of our recovery program.
That's incredible, and it absolutely has to be, right? It has to be part of it, and people don't know. So that's very encouraging.
Yeah.
And like I said earlier, the tide is turning.
It's turning because people are becoming better informed.
People are demanding more options.
And so are doctors and medics.
Yeah.
They're demanding access to more. I spoke to a young oncologist at the beginning, and I said to him, do you mind if I ask why you're here? Was it patient-driven, or is it your own personal interest? And he said, it's very much patient-driven. And he said, I'm getting asked about it all the time, and I really want to help my patients.
The Food and Forgotten Medicine seminar,
And he said, I really want to help my patients, and I can't because we're not trained in anything like this.
Well, the young generation of oncologists hopefully are really going to transform conventional cancer treatment. I mean, I really hope they are. Because they're coming up in the age of social media. They're seeing all this information. They're not just locked into what they're told in med school. I mean, they're just seeing stuff on TV, on the internet, on Facebook. They're seeing all this information.
That's right.
And we're getting through to some of them, so that's good.
And how did we ever get to a point where we thought that diet and nutrition has no bearing on our health? I mean,
I know.
To me,
I know.
How can I go with a system that ignores that aspect?
I know.
I don't know if that's even sane, let alone rational.
It's not.
And I'm a rational person.
I'm a highly rational person.
Well, exactly.
We had the same thought processes,
Yeah.
you know, in the beginning, which is obviously why we made the choices we made, because we
Yeah.
questioned the status quo, you know, and I'm a very instinctive person, and if I'm going to do something, it has to make sense to me.
Absolutely.
And if I can't make sense of it, there's a resistance, you know, an internal resistance I'll have to doing it. So, but anyway, most of these folks know my story. So I know that they want to know like what you did.
Right.
So let's talk about that.
Well, I interviewed several consultants, and just to get different points of view, I had that lymph node biopsy, and they said to me, we never find any more with people that have the same result as you, but we still want to remove all of your lymph nodes, or the majority of them. At the time, I wanted surgery, but I wasn't going to have chemo. I investigated it. I spoke and interviewed to oncologists, and at the end of the day I thought, you cannot poison me well. I'm not actually ill, so I cannot see how you can poison me well. So I decided I'm not going to do that, and especially not nearly poison myself to death before I'm going to have major surgery. That's back to front. Where did we get that idea from?
Yeah.
I'm going 9 rounds with Mike Tyson, you know?
Yeah.
I want to be fit and ready for that. I don't
Right.
want to be half comatose from
And
it.
it's standard practice in a lot of cancers now that they're giving
Yeah.
chemo before surgery
Well, I asked them,
to shrink the tumor. I mean, you're weakening your body so much, and then you're going to operate
and
on
I
it?
said, why would I want to do that to myself before major surgery? And the answer was, well, it might shrink the tumour. Actually, debulking a tumour makes no difference to the stem cells. No drug
Right.
or chemical kills stem cells.
Right.
Lots of natural protocols can and do kill stem cells.
Yeah, and enable your immune system to kill them.
Exactly.
Yeah.
Well, that's how it works.
Yeah.
Why would your immune system not be involved in your recovery program? It will start off by destroying it. And I was told, well, it may shrink your tumour. We can't guarantee it. And if it does, it means you'll have less of a surgery. And I said, for goodness sake, I said, I'm 50 years old at the time. I'm not 19 years old. Why would I go through all of that in order to have a better pair of jugs at the end of the day? How dare you make that decision on my behalf?
Right.
That I'm more concerned about what my jugs look like than about the whole system and science of cancer recovery. So no, I didn't go down that route, but I was going to do the surgery route. Anyway, they wanted to remove all my lymph nodes, and when I kept questioning, what I kept saying was, oh, well, because it is safer. And I said, but how is it safe? They couldn't tell me how it's safer. So I went to another hospital, and the funny thing that happened, I went to an integrated doctor, Dr. Andre Young-Snell in Brighton. He's a medical doctor of over 20 years at the time, and he does integrated medicine for all kinds of illnesses and diseases. And I said to him, I'm going to have the surgery, and then I'd like to come back and do the integrated treatment, but I want to prep for surgery. So I went on the metabolic diet. Within 3 weeks, that tumour that had been hard and calcified like a stone, they couldn't get a proper biopsy for it. They tried to break it open, and thank God I stopped them. But they took cells from the outside, so we still had a pathology. And it broke down to jelly. So of course I said, oh, it's changed, it might be spreading and all that. And I thought, well, it's a bit of a coincidence, it happens. So anyway, I went to another hospital because Dr. Andre said it will be the dietary regime that you've used, but don't ask alternatives because they'll also, oh, it's wonderful, go to another hospital where they haven't seen you and get a scan. I did that. I met a very aggressive bully there, but that's just another story. Nothing to do with the hospital or his profession.
Yeah.
Just got the personality defect. And I said in my book at the time, he was a lot closer to death than I was in speaking to people like that.
Yeah.
But
I
anyway,
understand.
I had the scan there, and I said to the radiologist, can you tell if a tumour's still active or not? And he said, sometimes you can. And he showed me. And he said, that tumour's lying completely inert and flat along the tissues. You could see it was. And he said, that's a very good sign that your treatment's working. So I thought,
And it was still in your body at that time?
Yes, when I thought, I'm in a position now where it might be safer, because I was only 3 months into it. This was the September, I was diagnosed in May the 11th, and this was September the 7th. And I thought it might be safer in the short term to leave well alone. If I stopped it progressing, then I need to take some time and continue with what I'm doing, but keep monitoring it.
Right, give your body time to heal, stick
Absolutely.
with the protocol, and monitor. Yes.
Exactly. I then found a fantastic consultant who's still my consultant now. He's semi-retired. And I said, I'll retire from being a patient when he retires from being a consultant. So we're still together. We're actually co-authoring a paper together, a review paper together. And I went to see him, and the first thing he said to me was, tell me how you got to be here. I had all of my paperwork. It's critical. I've got to say to the camera, keep your records on you at all times. Keep copies of everything. So
get them before you leave every appointment if they're available, because they do get lost.
They do get lost.
And I have some records. I mean, I have most of mine, but there were a few records from different visits I made that they're gone.
Yeah.
You know?
And keep notes.
Yeah.
Every session you have, keep notes, because what you think you heard and what you hear are actually sometimes different.
And I actually recommend that you record the conversation on your phone, right? Everybody has a smartphone. You all have a voice recorder.
I didn't at the time.
Well, that's true. This was, well, I didn't either. But yeah, you just press record and record every conversation you have with a medical professional, because again, they will say sometimes very strange things.
That seem strange.
That are strange at the time, and when you play them for other people, they'll be like, whoa, that was strange.
Yeah.
And then and other times they'll tell you things that you forgot, right? And you want to recall those things.
Yes, or they say just a little thing that is of massive importance to you. Yeah. But you didn't hear it at the time. And I've never met a medic yet who has any issue about being recorded or writing notes or anything like that. All of them, apart from that one, were really supportive and just wanted to try to help.
Good, yep.
And anyway, he asked me how I got there. I gave him all my notes. He examined me. And at the second hospital as well, they said to me, you're lymph positive, you're probably too late anyway, it's months into it, you're not going to survive, and blah, 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 blah. Went to the third consultant. He examined me after he asked me my story. At the end of it, he said to me, I don't know if you'll survive or if you'll succumb. Only time will tell. But at this moment in time, you are not in any danger. And he said, as far as the lymph node issue is concerned, he said, I've done the biggest lymph node trial in existence, to my knowledge. I agree with you, you shouldn't have any more lymph nodes removed because it isn't safe. And because it's English, he said, but however, we shall remember that the enemy has visited. And I asked him, I said, would you agree to be my consultant? And he said yes, on the condition that I'm just a conventional medical consultant, and if we find that your treatments are not working out in the way that we would wish them to, we can discuss and consider the wonders of what medical science may have to offer. So
fair enough.
That was our agreement.
That's amazing. I mean, clearly a very, very caring, wonderful man, right?
Yes, yes.
And that he was, that he was honest with you, right? And that he was willing to support you, because, again, a lot of cancer patients, they don't have a doctor. At least initially, they don't have a doctor that'll support them.
But I looked.
But the takeaway is that you found your support. Right, you found your support, and I tell people that all the time: is you've got to talk to more than one. If you don't like the doctor you're working with and they won't support you, go find another one, or 3 or 4. I mean, how did you talk to? I interviewed him in my book. Yeah. And I said, what advice would he give cancer patients? And he said, if you are not happy with the team that you have, find another one that you are happy with and you can work with. And at the end of the interview, I said to him, why did you choose to monitor Jessica Richards? Because I was asking on behalf of the readers. And he said it was a sense of fairness. He said, because the sat-nav doesn't always get you to where you want to be. And sometimes we have to make different choices. And he actually used the word slashing, burning and poisoning doesn't resolve it
for everybody.
Yeah, right. We know that's true.
Yeah.
So the rest of your treatment and progress, were there any other sort of notable things that happened during that? Probably too many to. It's all in the book, I'm sure.
Yeah. Well, not that the first part of it.
But just take me through some of the highlights that you feel like treatments that you did. Maybe
it's an interesting thing that the highlights are the same as the lowlights are the same thing. But you've probably experienced that yourself. The best moments were also the worst moments. So I would say diet, and for goodness sake, if you exercise, do proper exercise. Honestly, proper exercise. You're going 9 rounds with Mike Tyson at his best. So relaxation is excellent, but please do some proper exercise where you get out of breath and where you use your muscles and stuff. You know, when people say, oh, well, I'm going on a rowing holiday in a couple of weeks' time, and you think, you're not going to make the Olympics with that. And I don't mean to put people down by this, but it is critically important. You make yourself super
You've got to move
fit.
your body every day. You've got to break a sweat. You've got to huff and puff. It doesn't matter. You're walking, running, riding your bike, yoga, karate, rock climbing.
If you do it from
rowing.
a chair, something. If you can't get up, do it from your bed if you have to. But for goodness sake, do something every day. Put something in your favour. Put the odds in your favour. Every tiny little thing, and by aggregate,
that's right.
You will get there. But don't ever concern yourself with the outcome. Leave that to something else.
Enjoy the process, right?
Yeah.
Enjoy it. Enjoy the process.
I tell you what, it's a trip. It's not boring. It's definitely not boring. But then a very unexpected thing happened, because during the first 5 years, I lost both of my parents, split up with my long-term partner, and lost contact to most of my family. Through no fault of theirs, just think when parents die, things happen. You know?
Yeah.
And but then a funny thing happened, is that I got what I'd been longing for, what every cancer patient longs for, is the letter from your doctor that says, come back in a year. So I thought, I was waiting on that and waiting.
Yeah.
And in my mind, in my imagination, I was going to be at the hospital with my partner. When we came out, he would tell us, we'd phone my parents, we'd phone his mother, and then we'd come back and tell all our friends. The reality of it, I was home alone. It was the 29th of February 2012. It's a bit of a creepy day anyway. And I got the letter because he wanted to check my blood test first. And it said, we'll see you in a year as discussed, so cancel the 6-monthly appointment. And I took a dive because I was there alone. My parents were gone, my partner was gone. I ended that, by the way, so I don't want anyone to think he's a bad person who abandoned me. He didn't. He's a decent person. And
but you didn't have anyone to celebrate with?
Nothing. I was like, what do you do on your own? You know, I was in a long dressing gown. It was an English winter with woolly socks hanging off the end of my feet like a pair of knitted flippers. It was not a glamorous sight, and I'm ashamed to say that in front of a nice young man like yourself, but you might need to poke out your mind's eye after that.
No.
Anyway, suddenly everything became black and white. Everything slowed down because you're no longer on a mission. And I felt like Miss Havisham. If anyone's read Dickens, Miss Havisham, she was jilted on her wedding day, and she became an old lady still in her wedding dress and everything laid out, the wedding feast with rats, and it was like that. My house wasn't bad, but it just looked like I hadn't even noticed it for 5 years.
Yeah.
And then I hit the deck, and I hit the deck so hard and for so long. I could have sold advertising on the soles of my boots. I was just... And I stopped looking after myself. I fell off the wagon. I didn't go off the diet because it would be physically impossible, because it's so ingrained.
Yeah.
And I didn't have a bad diet anyway. That was just it. I started to have a drink. I didn't get drunk. I am a very cheap date, by the way, but even then I still didn't get drunk.
Yeah.
But I started drinking, which I hadn't done. You know, you don't drink with cancer. If you want to throw kerosene on a fire, drink when you have cancer, drink alcohol. Right. Don't do it, just don't do it. Well, anyway, I knew things weren't going good because the tumour, which had been completely dormant, started to kick off, and I could see and feel it was involving the skin. It wasn't coming through, but there was a dark mark there, and I knew what that was, and it had started to go hard again. So then I had to make a decision, because what I found is that I was having to go back to my killer lifestyle, working myself to death, to pay for treatments, to keep myself alive, so that I can work myself to death.
Yeah.
And I thought, do you know what? This ain't doing it for me. And you know, I'm a bit of a lone wolf anyway. But I thought, this is a pointless existence. And the winters in the UK are not fun. They're very dark for most of the time. So it's dark by 4 o'clock in the afternoon. You know, it's just dreadful. And I came over all unnecessary, as we say over here with our stiff upper lips. I definitely came over unnecessary.
Yeah.
And I just didn't want to be around anymore, and I didn't want to do it anymore. After the year, and I went back to see my consultant, during that time I decided it was the worst experience in the world for me, is waking up alone in the early hours of the morning knowing I'm either going to die a slow death from cancer, or I have to take care of it myself. There's no other way out of this. It's the worst place of aloneness. It's not loneliness, it's utter aloneness. And then I devised a plan. I'm going to check out, and I'm doing it my way. So I got rid of everything in the house, got rid of my winter coat, because I decided the only power I've got, I'm not going to see another winter. I've done with winters, so I'm not going to do that bit. Went to see my consultant, because I always went back to see him when he asked me to, out of respect. But I'd already made up my mind. My ex's mother always came with me, because we're still the greatest of friends. Even years later, we still are. She just had a holiday with me last week in the heat wave. And he looked at me and he said, "What's happened?" And I said, "Oh, you know, this and that." He said, "What's happened?" And he kept pressing and pressing. And I said to him, "Look, I'm not going to make ancient bones." And I asked him, I said, "I'm sure lots of women have offered you their bodies over the years, but perhaps not in the way that I'm going to. But A, is it of any use? And B, how do we go about it?" And he said, "We need to talk about that another time." I didn't want to talk about it too much in front of my ex's mother. And anyway, I told him a bit about what had happened. And he said, "Would you come back in 6 months?" And I couldn't even look at him. I was looking at the ground, because I had no intentions. I was done. It was my final visit. He said, "Please, will you come back?" And he kept on and on and on. And in the end, he said to me, "Would you at least think about coming back? I don't want you to go off the radar." So I said, "I'll think about it." I agreed to think about it, but I had no intentions of going back.
So you were just prepared to die?
Yeah, I'm just going to do it.
You're just going to die?
Yeah. Not because I was necessarily depressed, but I had no reasons to carry on.
Nothing to live for.
It was too hard to keep going on with no reason, no purpose at the end of it. I'd run out of reasons. I thought, I've got no reasons left in my bag here.
Yeah.
At the end of that consultation, Sheila was sitting there, and my consultant, I always give each other a little peck on the cheek before we go, because you're with your consultant for years, you know. And I gave him a little peck on the cheek, and he suddenly embraced me. And I don't know how long it was for. I've no idea. It could have been seconds. I have no idea. But at the end of it, I looked at the ground, and then I looked him in the eye, and I said, "Do you know what, Mr. Kissy?" I said, "I may have run out of reasons to keep going, but I'm going to do it again out of bloody mindedness." So I said, "When do you want me back?" He said, 6 months. I said, "I'll be back." So I went out of there, went straight back on the wagon, and that was in the January. The following July, I gave him half of my tumour in a histology pot. I kept half of it. I went home and
So they took the tumor out?
No.
How'd they do?
Sometime before, and I'd kept a note of this, a lady called Laura Bond, who wrote a book called Mum's Not Having Chemo.
Yeah. I'm familiar with that.
She's a great blogger. And I don't always read blogs, because there's too many of them, they're too often, but hers, I used to keep and read. And one time she wrote one, and it said, black salve saved my life. And I thought,
yeah.
I'd been into it for about 5 years. I thought, I've heard of everything 1,000 times over. I've never heard of black salve. So I kept it. When I got back from his office, I had a look into what it was, ordered myself a pot, And I thought, I'm going to go for it. I couldn't find anybody who knew anything about it at all. And in the end, I did get hold of someone in New Zealand. Most people had never even heard of it, but I did as much research as I could.
Mm-hmm.
Then on my 6th anniversary, because every anniversary I post a picture on my website, an anniversary, on my Facebook page, an anniversary photo. I did my anniversary photo, and when the photographer left, I thought, today's the day, so 6 years. I locked the door, and I had a word with that tumour, and I said, I will endure whatever I have to endure, because at the end of this, you're going, or we're both going, and I really don't care which one of those it's going to be. 30 days of indescribable hell later, because I used too much of it. I was sitting on my bed looking at that tumour in a histology pot on my chest of drawers, and I said to it, that's the only chest you're getting in this house. But
So the tumor fell out.
came out, I captured it, cut it in half, and then I gave him half of it. He had it analysed at the lab at the hospital.
How big was it when it came out?
It was 3.5 to 4 centimetres. I photographed it next to a ruler.
Yeah.
And you could. It was about that size
Yeah.
when it came out, and sliced it right through the middle. And I got a copy of the histology report, and it's all in my medical records. And it showed what had once been a tumour. You could see there were tumour cells, were completely necrotised tumour cells. So it was a dead tumour that came out.
Dead tumor fell out.
Yeah, but
With
boy,
black salve.
Yeah, I did went through hell to get it out, because I
Yeah.
didn't know enough about it. A, I used far too much. B, what I found as well is that I didn't know enough about the healing process. So when the tumour's dead, and you can feel when it's dead, you're supposed to actually salve that out with like an ointment to soften
Work it out.
and then gradually, because it's quite a deep wound, heal that in layers with more herbal salves so that it heals out. But even so, I still only got a small scar. And I'll show you it later if you want.
It's okay.
No, please
not necessary.
Don't cry, Chris.
Yeah.
You'll be fine.
Oh, I've seen it all.
I bet you've seen it all.
Yeah.
Actually, that's what my consultant said when I gave it to him. He said, I've seen it all. The
Yeah.
very touching thing that happened, though, when I went to the hospital afterwards, I still had dressings on it. And I said to him, do you want to see it? And he said, yes, have a look. So I said, okay, and I brought all my dressings with me. I said, where can I wash my hands? I washed my hands, and when I turned round, my surgeon was standing there holding my surgical gloves for me to help me on with them so that I could show him.
And what did he think when he saw it?
Oh, he said it's very inspiring.
Yeah.
And he said, of course, we still have to do the usual stuff, you know, mammogram and a biopsy, etc. And I said, well, guess what you're not getting? And he said, I know, a mammogram and a biopsy. I said, that's a fresh wound, and all of those things are just going to show there's scar tissue or mass there. It's not going to define what it is. And I said, we can see that with our own eyes. We don't need to do scan. And also, I didn't want to get into that situation where you're back at the hospital having scans, oh, we found a mass and all that. I mean, that was 3 years ago now. Totally fit, totally well. There's no trace of tumour, there's no trace of cancer. My blood tests are all normal. I'm 60 in February, and I'm obviously not on death's door.
Hey,
Not
wonderful
yet.
story. Well, Jessica, thank you so much. And listen,
Thank
everybody
you.
watching, if you're watching this on YouTube, there will be links to Jessica, to her book, and to some resources and things that she will provide me to share with you on chrisbeatcancer.com. So make sure you click through and look at the show notes to get links to helpful information.
Thanks.
So-
I am actually writing the second book as well with
Good.
all that other information in it. So
Okay, good,
bless
good,
you
good.
for sharing everything, Chris.
Well, look, thank you for taking time to do this interview. I'm so pleased to meet
Thank
you
you.
in
I'm
person.
delighted to. It's
Your
brilliant.
story is so inspiring. I know it's going to inspire a lot more people. So
In fact, you asked me a few years ago to do an online interview.
I did. That's right.
And I
you
said
turned
at
me
the
down.
time, yeah,
You,
but
you
you
blew
know
me
why
off.
I turned you down? I turned you down. I was about to do the black salve, and I said to you at the
Oh.
time,
Interesting.
I'm about to do a process, and you can have an interview after this. but I'm not in the right place to do one now because I was just about to engage in the black club, or I just engaged in it.
Yeah,
so it wasn't right to do it at that time, but I said, you will have your interview.
Yeah. Yes, you did.
And you're the first one that's done a real full interview on this since I've done it.
First one. You saw it here first.
Hey.
That's great.
Been a long time since I've had a first as well, I can tell you.
Thank you, Jessica.
Thanks,
Thanks
Chris.
for watching, everybody. Please share this. This is incredible life-saving information. Share it widely. And I will see you on the next one.
Keep well. Lots of love.